SARS-CoV-2 DELTA VARIANT. It's been going around and around the news for quite some time now. Ever wonder what this SARS-CoV-2 or SARS coronavirus 2 Delta variant is all about? In this video, let's understand more of this Delta variant. But before we do so, hit the subscribe button below and be part of the Neuro channel. COVID-19, named as such by the WHO since it was a coronavirus disease that was first reported last 2019, is a contagious disease caused by the SARS-CoV-2 virus, a type of coronavirus that causes severe acute respiratory syndrome. The index case was first reported in Wuhan, a city in the province of Hubei in China, last December 2019, and the disease has since spread worldwide, causing this ongoing pandemic. COVID symptoms vary and includes fever with cough and shortness of breath, headache, fatigue, as well as that peculiar loss of taste, which we neurologists call ageusia, and loss of smell, otherwise called anosmia. As of the making of this video, now being early September of 2021, there have been already identified quite a number of variants of interest, or VOI, as well as variants of concern, or VOC. SARS-CoV-2 variants of interest include those having specific genetic markers that are associated with modifications to receptor binding, thereby causing reduced neutralization by those antibodies that have been produced due to previous infection or vaccination, reduced treatment efficacy, as well as changes in the potential impact to diagnosis and potential increase in the severity and transmissibility of disease. On the other hand, variants of concern are those which already have evidence of increased transmissibility, increased disease severity, causing higher hospitalizations and deaths, as well as failures in diagnostic detection, decreased treatment or vaccine effectiveness, and a significant reduction in neutralization by pre-existing antibodies. The SARS-CoV-2 Delta variant, otherwise known as lineage B.1.617.2, was first detected in late 2020 in India. This variant has mutations identified in the gene encoding for the SARS-CoV-2 spike protein. These mutations cause the substitutions classified as T478K, P681R, and L452R, which are all known to increase virus transmissibility, as well as its neutralization by antibodies produced from previously circulating COVID-19 virus variants. On May 7, 2021, based on transmissibility assessment being at least equal to that of the B.1.1.7, which is now also called the Alpha variant, that variant which was first detected in the UK last October 20, Public Health England revised the classification of lineage B.1.617.2 from a variant under investigation, or VUI, to a variant of concern, or VOC. At that time, the UK Scientific Advisory Group for Emergencies, or SAGE, has estimated a possibility of it being 50% more transmissible than the Alpha variant. Subsequently, this variant was also classified a VOC by the WHO on May 11, 2021, as well as by the US Centers for Disease Control on June 15, 2021. This variant was eventually given the name Delta by the World Health Organization last May 31, 2021, after it opted to assign labels for key SARS-CoV-2 variants using letters from the Greek alphabet, which are simple and easy to say and remember. So why is the Delta variant now very important? Delta is now a major worry for health authorities around the world. It is considered partly responsible for the second wave of the COVID-19 pandemic in India, which started sometime last February 2021, as well as the third pandemic waves in the UK, South Africa, and Fiji. By July 2021, the Delta variant has also driven a surge in COVID-19 infections in Asia, including the Philippines, where I am currently based, Australia, and the United States. As of the making of this video, the Delta variant has already spread to approximately 163 countries around the world, with the WHO indicating it as fast becoming the dominant global strain of COVID-19. So what are the important things that we all should know about this Delta variant? First, we should all be aware that the Delta variant is more contagious and transmissible than the other COVID-19 virus strains. After its first identification in India in December 2020, it soon became the predominant strain in India and then in the UK. Today, it is fast spreading around the world. In a neutral and mitigated environment where no one is wearing masks and no one is vaccinated, the original strain will infect about 2.5 other people. In the case of Delta, the spread would be higher to about 3.5 to 4 other people. A study in China notes that those infected with the Delta variant can carry as much as 1,000 times the viral load as compared to those with the original Wuhan virus strain. Those most at risk to be infected with the Delta variant are the unvaccinated individuals. Children and young people are also of particular concern, since the Delta variant seems to be infecting the younger individuals more than previous variants. A recent study in the UK showed that children and adult individuals below age 50 were about 2.5 times more likely to be infected with the Delta variant as compared to those who are 50 and above. So far, the greatest majority of children around the world are not yet vaccinated. So as more of the older age groups get vaccinated, the younger age groups and the unvaccinated older individuals will have a higher risk of getting any variant of COVID-19, especially the more infectious Delta variant. As the Delta variant surges around the world, we still have more to learn about it. Will the Delta variant make you sicker than the Alpha variant or the original strain? As of this presentation, available data is still quite unclear. However, it has been noted that the symptoms seem to be a bit different than the original SARS-CoV-2 strain. There have been reports that with this Delta strain, anosmia or loss of smell and cough seems to be less common, but fever, headache, runny nose, and sore throat are still present. And what about COVID-19 vaccines and the Delta variant? Medical experts are still learning more about Delta, its breakthrough cases, and vaccines. In a study preprint annotated by the UK PHE, at least 2 vaccines have been shown to be effective against Delta. Among tracked participants who were fully vaccinated with recommended doses, the Pfizer-BioNTech vaccine was noted to be about 88% effective against symptomatic Delta variant disease and 96% effective against hospitalization. On the other hand, the Oxford AstraZeneca vaccine was about 60% effective against symptomatic disease and 93% effective against hospitalization. Similar reports have also been noted for the Moderna and Johnson & Johnson vaccines. As of this video, no data are yet available for the other vaccines. So how do we protect ourselves in the face of this Delta variant? Foremost, getting fully vaccinated with whatever available vaccine in your locality is still the most important thing you can do to be protected against the Delta variant. If your vaccine needs 2 doses, then make it a point to get both shots. And whether or not you are vaccinated, it's still imperative to follow minimum standard COVID-19 prevention guidelines. Always wear face masks when facing other people, especially those who are not in the same household as yours. This still applies and is highly encouraged even if you have already been vaccinated. Wearing a medical-grade mask in public indoor settings, especially in areas of high COVID-19 transmission, helps prevent the spread of the Delta variant and should specially protect others who are most vulnerable to COVID-19. And who are these people deemed vulnerable? They are the elderly and the immunocompromised, those who are still unvaccinated, and those with comorbidities putting them at risk for severe disease. Next, strictly observe social or physical distancing, especially in public places. As much as possible, keep yourself at least 1 meter away from other people. And last but not the least, don't forget to do proper hand washing and disinfection at all times. These basic measures can definitely save lives. And that's what we have for the SARS-CoV-2 Delta variant. Thanks for watching. Don't forget to give a thumbs up for this video below. Click the notification bell to be updated of new videos in this channel. And don't forget to subscribe to Neuro. Have a great day, stay clear from Delta, stay safe from COVID, and see you in my next video.